Have you considered that your low back pain is coming from your pelvic floor? I have seen time and time again clients come in after chasing back pain for many, many years. Some clients even end up having back surgeries, but yet they still end up with having back pain. Their back pain isn't cured by these injections and these surgeries. They still have perpetual back pain. What if I told you that your pelvic floor could be playing into your low back pain? It makes me want to just shout this from the rooftop. Every single person that has low back pain and has decided that they are done chasing their low back pain and they sign up for an injection or they sign up for fusion or a laminectomy to help solve their back pain needs to know what their pelvic floor is doing and should consult with a pelvic floor physical therapist prior to signing up for any type of back intervention or surgery. The reason being is that a lot of times the back pain can be stemming from something happening inside the pelvic floor. And even if it's not stemming from something inside the pelvic floor, like if you've told me that you have a disc herniation or you have stenosis in the back, which is narrowing of the canals where the nerves come out, whatever you have going on, if you treat and balance the pelvic floor, and for that matter, balance any of the muscles that attach to the pelvis, you are going to have a massive impact on reducing the pain and stress in the low back. Hear me out. Your pelvic floor is a bowl of muscles that sits at the bottom of the pelvis. It's the very bottom of the core. The pelvic floor also is responsible for functions like bowel movements, urinary function, and sexual function. The pelvic floor is involved in so much, but what people don't know is that the pelvic floor, when it's not functioning appropriately and correctly, can cause low back pain and can perpetuate any back injury from lasting from a really long time. So let's talk about why that is. Well, the pelvic floor has 3 layers of muscles. The first layer, the second layer, which isn't shown here, and then the third deep layer. The third deep layer attaches to the hips, attaches to the coccyx, and attaches to the sacrum. When you have back pain, the pelvic floor will tighten and your glutes will tighten to protect your back and it's a compensatory pattern. In order for the body not to experience that pain, our bodies tighten to try and reduce the pain. You might then go to other types of therapy. Maybe you do chiropractic, acupuncture, physical therapy, and you get the back pain to reduce. Maybe you're doing exercises and whatnot to help the back reduce its pain. Well, the deal is, if the pelvic floor isn't conditioned and trained or you're just doing Kegels, it's not going to help the low back pain. Why is that? Because the pelvic floor needs help in opening up. This muscle is a muscle that should contract, it should relax, and it should overstretch. When we are in any type of pain, the muscle will contract and stay there. And it doesn't just go back to its resting position, its relaxed position. When it's contracted, it's pulling on the spine. So if this muscle is squeezed up nice and tight, it's gonna put the spine into a more flexed position, and it's going to pull the sacrum into a more flexed position, which is going to stress the spine out even more. So you're going to have more pain in the lumbar spine, which is your low back, more pain in the thoracic spine, and even in the neck. So how do we make this go away? Well, you should work with a pelvic expert physical therapist that will help open up your pelvic floor, bringing you range of motion of the pelvic floor that will help take the pressure off the low back and also help prevent the tightness of the pelvic floor and the over contraction of the pelvic floor from continually pulling on the spine. Now you might say, but my pelvic floor is really weak. I pee my pants, or I leak, or I can't achieve an orgasm, so my pelvic floor must just be really weak and it doesn't work. Wrong. If your pelvic floor is not working for you, a lot of times it's because it's stuck in that tightened position. So we need to help open up that pelvic floor in order to not just take the pressure off the low back, but make it so you don't pee your pants anymore. Change your positioning so you can improve the functions of the pelvic floor, improve your experience of intimacy, improve your bowel function, improve your urinary function, and improve your core function, which is all going to help take the pressure off the low back. The moment that you have any dysfunction in the pelvic floor is a lot of times the moment that you're gonna experience pain in that low back region. Now, it's not just the pelvic floor. We have to also balance the muscles of the hips and the glutes, because if your glutes are really tight, that's gonna pull back on that lumbar spine, creating that more flexed spine, and then that's gonna put more stress and strain on the low back, exacerbating and increasing the low back pain. Then we need to look at the other areas of the muscles that attach to the pelvis. You have the front of your legs, which are your quad muscles. You have your outside, which is your IT band and your tensor fasciae lata. And then you also have the back of your legs, your hamstrings. Then you have your inner thigh muscles, your adductor muscles. Anytime that you have these muscles that are pulling tightly on your pelvis, or they're pulling more on one side than the other, that can cause shifting in the forces through your spine, which can also increase the low back pain. So it's really important, if you're suffering with chronic low back pain, to balance everything inside and outside of the pelvis in order to get rid of this low back pain. Then we can do exercises to stabilize and help create and maintain the balance that you experience in your body. This will then reduce the chronic inconsistency of the low back pain that you're experiencing. Now, there might be other patterns that need to be changed in your body in order to truly get rid of this low back pain once and for all, but you can never ever overlook the importance of the pelvic floor and the external pelvic muscles in reducing the strain on the low back. So truly, if you are considering a low back surgery, you must take a look at what's happening inside your pelvic floor and outside in your pelvic region. And if you've been chasing this low back pain for a long time, I highly suggest that you do this. We just had a client come in last week, and during her evaluation, she had multiple back surgeries, and then currently she just had a lumbar fusion, and she has a cage in her low back, and she still has low back pain. And now that she's treating her pelvic floor muscles, which referred pain exactly to where she feels it in her low back, now that she is dealing with her pelvic floor, she no longer is having back pain. She walked in with walking with ski poles, and now she, even just a couple weeks later, she is walking without her ski poles, all because she's learning how to open up, relax, and control her pelvic floor, and then strengthen her core, because she's getting symmetrical balance across her pelvis. Now, does she have a ton of scar tissue from the constant surgeries? Absolutely, and that will need to be addressed as well. But the reality is, maybe she didn't need the lumbar fusion in the first place if she had just had the pelvic floor therapy beforehand. So save yourself a surgery, save yourself some injections, and check out what's happening with your pelvic floor. I'm Dr. Allison Feldt. I own Body Motion Physical Therapy. We are located in Edmonds and Poulsbo, Washington, and we help people all across the world who will fly here for a course of treatment for a week, and where we do intensive treatment. We use pelvic floor physical therapy, balancing of the pelvic floor and all the pelvic muscles to help relieve low back pain once and for all. So hope you found this beneficial. If you have questions, please drop them below. I'm happy to answer them. Have a lovely week.